You're reminding me of a conversation I had with my wife a couple of years ago when I was trying to get more workup, and doctors just seemed like they were being very dismissive, and I almost felt like I was going crazy. And I asked her if that was her opinion, to which she responded, "Well, you've been overseas where they burned everything in sight. You've been in this sand that we know to be toxic. You've been blown up, which is a factor for lung injury. Why, if you have all these risk factors, would it be so hard to believe that someone could be having adverse health consequences because of that?" But a lot of veterans are having these stories right now. What, from your perspective, both as a doctor but also having worked with a military population for all this time, do you think factors into that?
Well, it's interesting the way you presented your question that, am I going crazy, right? Is it me? Um, and you have a unique perspective being in the medical field, but you also have a unique aspect to your personality in that you're persistent. And you can imagine that most patients, most people that are seeking answers, that receive an answer, accept that answer from the medical profession, and they're not persistent. So, how many of those individuals are in the same exact category as you, but we're completely ignoring them or unrecognized or don't recognize them because they don't have the same persistence? And that's exactly what I saw. Was there was a group that I cared for that were special forces, and they're a fairly unique personality type, and every one of them wanted to get back to duty. They wanted to get back to their job. That's not a typical patient that is malingering or that's fabricating their symptoms. Certainly, that same group also has a tremendous amount of risk for PTSD and other psychological and other injuries, TBI, and so they have a complex. They're in a complex warfighting environment, but they want to get back to their jobs, and they're much more persistent in terms of looking for an answer. I think that's a critical aspect of it. Is can you look at the individual, draw a timeline, look at their history, look at how their symptoms presented, and you have a much better understanding that this does not look like somebody who has a pure psychological issue. And when you do the testing and when you ask for your behavioral health, your psychiatrist and other colleagues to help you, you find that these are not pure psychological. They may have some PTSD. They probably should have some PTSD, from my perspective. But they're not clean. It's not a clean, one-to-one, symptoms diagnosis. It's not that easy.